Fatty liver disease explained. Causes, symptoms, and treatment that works. If you've ever been told your liver enzymes are a little high, or you've noticed some ongoing fatigue and discomfort on the right side of your abdomen and just brushed it off, I need you to pay attention, because fatty liver disease often has almost no symptoms until it's already progressed. I'm Dr. Matthew Harrison, and today I'm walking you through exactly what fatty liver is, what causes it, and the fatty liver treatment approach that's actually backed by real evidence, not just another supplement ad. Here's what makes fatty liver disease tricky. Most people find out almost by accident. A routine blood test comes back with slightly elevated liver enzymes, or an ultrasound done for something else notices fat in the liver. There's rarely a dramatic symptom pushing you to get checked. And by the time some people do feel something, fatigue, mild discomfort under the right ribs, or unexplained weight changes, the fat buildup may have been there for years. The encouraging part is this. In its early stages, fatty liver is one of the most reversible conditions in the body. The liver has a genuinely remarkable capacity to heal itself once the underlying cause is addressed. In this video, I'll cover what actually causes it, how it's diagnosed, and the specific evidence-based changes that help reduce liver fat. Plus, one thing people waste money on that almost never helps. If topics like this, the ones that actually explain what's going on in your body, instead of just selling you something, are useful to you, hit subscribe now, because I've got more of these breakdowns coming. Let's get into it. Fatty liver disease means fat has built up in the liver cells beyond what's normal, generally more than 5 to 10% of the liver's weight. There are two broad categories: alcohol-related fatty liver disease caused by heavy alcohol use, and non-alcoholic fatty liver disease, often shortened to NAFLD, which happens in people who drink little or no alcohol at all. NAFLD is by far the more common form today, and it's become one of the most widespread liver conditions in the United States. So what actually causes non-alcoholic fatty liver disease? The biggest drivers are insulin resistance, excess body weight, particularly fat carried around the abdomen, a diet high in refined carbohydrates and added sugars, especially fructose from sources like sugary drinks, and a sedentary lifestyle. Other contributing factors include type 2 diabetes, high triglycerides, and in some cases genetics, which is why fatty liver can occasionally show up even in people who aren't overweight. It's worth understanding the spectrum here too. Simple fatty liver on its own often causes little damage, but in a portion of people, it can progress to something called NASH, non-alcoholic steatohepatitis, where there's inflammation and liver cell damage, and over time, that can lead to scarring or fibrosis. That's exactly why catching and treating this early matters so much. In the early stages, fatty liver disease very often causes no noticeable symptoms at all, which is exactly why it's frequently found incidentally. When symptoms do show up, they tend to be nonspecific: fatigue, a dull ache or fullness under the right ribs, or in more advanced cases, symptoms related to liver dysfunction. Diagnosis typically starts with a blood test looking at liver enzymes, followed by imaging like an ultrasound, and in some cases more specialized tests like a FibroScan, or less commonly, a liver biopsy to check for inflammation or scarring. This is the core of the video, so let's go through this properly. 1. Weight loss, the single most effective intervention. If there's one thing backed most consistently by research, it's this: gradual, sustained weight loss is the most effective treatment for fatty liver disease in people who are overweight. Studies generally show that losing around 7 to 10% of body weight can significantly reduce liver fat, and in some cases, improve inflammation as well. The key word is gradual. Very rapid weight loss can actually stress the liver further. So slow and steady, roughly 1 to 2 pounds a week, is the safer and more effective approach. 2. Diet changes that support liver health. There's no single magic fatty liver diet, but a few consistent patterns show real benefit. reducing added sugars and refined carbohydrates, particularly sugary drinks and fructose-heavy foods, tends to have an outsized impact on liver fat specifically. Increasing fiber from vegetables, legumes, and whole grains supports both blood sugar control and gut health, both of which are connected to liver fat. And a Mediterranean-style eating pattern, rich in vegetables, healthy fats like olive oil and fish, and lower in processed food and red meat, has some of the strongest research support of any specific dietary approach for fatty liver. 3. Physical activity. Exercise helps in two ways here. It supports weight loss, but it also appears to reduce liver fat somewhat independently of weight change, likely by improving insulin sensitivity. Research generally supports a combination of at least 150 minutes of moderate aerobic activity per week, like brisk walking or cycling, along with resistance training a couple times a week. You don't need to start with anything intense. Consistency over months matters far more than intensity in any single week. Managing related conditions. Because fatty liver is so closely tied to insulin resistance, managing blood sugar, cholesterol, and blood pressure isn't a side note. It's part of the treatment. If you have prediabetes, type 2 diabetes, or high triglycerides, working with your doctor to manage those conditions directly supports liver health as well. Alcohol and medication review. Even moderate alcohol use can add extra strain to a liver that's already dealing with excess fat. So cutting back or eliminating alcohol is often recommended, regardless of which type of fatty liver you have. It's also worth reviewing any medications or supplements with your doctor, since a small number can affect the liver. What about supplements and liver detox products? Here's the part I mentioned earlier. Despite how heavily they're marketed, most over-the-counter liver detox or cleanse products don't have strong evidence behind them for treating fatty liver, and your liver already has its own detoxification system that doesn't need help from a supplement to function. Certain things, like vitamin E, have been studied specifically in some NASH patients under medical supervision. But that's a targeted medical decision, not a general recommendation, and it's not something to start on your own without discussing it with your doctor first. If you've been given a fatty liver diagnosis, or you're just now realizing some of these risk factors apply to you, drop a comment and let me know. Are you dealing with this yourself, or looking into it for a family member? It genuinely helps me know what to cover next. And if this is the first explanation that's actually made sense without trying to sell you something, a like helps this reach someone else who needs it. A common question is how long it takes to see improvement. This varies quite a bit person to person, but many studies looking at diet and lifestyle changes show measurable reductions in liver fat within about 3 to 6 months of consistent changes, sometimes sooner with significant weight loss. Full normalization can take longer, especially if there's already some inflammation present. The main point I want you to take from this is that this is a marathon, not a sprint. The people who see lasting results are the ones who make changes they can actually sustain for the long run, not a strict 2-week reset that they abandon afterward. If you have risk factors like excess weight, type 2 diabetes, or high triglycerides, it's worth asking your doctor about liver function testing, even without symptoms, simply because fatty liver is so often silent in its early stages. If you've already been diagnosed, regular follow-up testing matters too, since it's the best way to confirm that whatever changes you're making are actually working, rather than guessing. A few habits worth flagging. Regularly drinking sugary beverages, including juice, which many people don't realize is a major contributor. Skipping meals and then overeating later, which can worsen insulin resistance. And chronic lack of sleep, which is increasingly linked to worse metabolic health overall. So here's the takeaway. Fatty liver disease is common, it's often silent, and in its early stages, it's genuinely one of the more reversible conditions out there. But the treatment that actually works isn't a supplement or a quick cleanse. It's gradual weight loss, a diet lower in added sugar and higher in fiber, regular physical activity, and managing related conditions like blood sugar and cholesterol, all sustained consistently over months. If this helped you understand what's actually going on and what to do about it, hit like so it reaches someone else searching for real answers instead of another detox ad. Subscribe because I'm covering related topics like insulin resistance and metabolic health in upcoming videos. And drop a comment telling me one change from this video you're going to start with. I'm Dr. Matthew Harrison. Take care of that liver. I'll see you in the next one.